All right. So that's where we were. That was it, where we came up with zero trends. Serious transformational approach to health. Integrate health and environment and culture. In quality terms, now we're going to fix the systems that lead to the defects. Safety learned that nearly 80 years ago. They learned you cannot wait for people to get hurt on the job. You have to fix it with eyes, goggles, helmets, steel-plated boots, gloves. Fix the systems. There's toxic floors, toxic fumes, toxic and slippery floors. 80 years ago they learned that. We haven't learned that yet in health. So now we got to fix the systems that lead to those defects. And it's going to be both the workplace and the workforce. Unions and workers, struck and revolted in the 1920s over poor work conditions. I think it's time for another revolution. To revolutionize the workplaces to get them right, and revolutionize the workforces to get it right. Business problem, you got to have a problem. What are you going to have a solution if you don't have a problem? Well, the problem is all those costs are unsustainable. And the idea is that in going forward in this world, as it becoming a flatter world, competition's worldwide. Some people don't even know where the competition is. I don't think you can be competitive without healthy and high-performing people. CEOs get it right away. They know the value of people. Some people later, lower down the organization, don't quite get it because they have deliverables they have to focus on. CEOs are the ones to get it. CEOs can lead us out of this. They may be the only ones that can lead us out of this. How can we turn cost into investment? Zero trends, that's what it's about from my point of view. When we first started this in the late 70s, we thought it was health management program, lifestyle change, healthier people, better employees against the organization. And we spent 25 years, nearly 200 publications now, proving that. And then it didn't work. I don't think it's worked. We got all kind of awards out there for people and, great programs and so forth. And there are some out there, I think. There's some out there doing it right. I can name you 10 or 12. I don't even know them all. But I think the solution is we got to put something in between that. That around the outside didn't work. We got to put that thing in between. 5 pillars, we call them. Senior leadership is the first pillar. It all starts with senior leadership. It has to. It can't start any place else. Create the vision, commitment to healthy culture, connect the vision and strategy, engage everyone in leadership in the vision. What's the vision? What's it going to be like to work around here? In orientation, here's what we do around here. Here's how we work. Here's how we get the job done. Here's how we prepare ourselves to do the job. Here's what the workplace is going to give back to you. Because I believe everyone should come to work with energy, enthusiasm, creativity, resilience. And when they leave, they have energy, enthusiasm, creativity, resilience, all the thing, vitality. But that means they have to be prepared to come and be high performers and then leave. The workplace has to be welcome them every day and give back. The workforce gives to the company. The workplace has to give back so that the workforce leaves with that same creativity so they can work in their communities and their homes. Because there's 3 main cultures, at least 3. The workplace culture, the community culture, and the home culture. Which one do you think is the most important? I don't know the answer to that. I'm just looking for some good answers. But we're going to try to find that from our future work. Senior leadership, commitment to the vision. Commit to the vision and have the courage. This takes courage. Absolutely courage. I give Obama credit for courage on healthcare reform. Whether you believe it or not, he had courage. Finally, he screwed it up in the first part. He didn't do it well. But the last part, he had the courage to stand with it. And all the senators and House representatives had the courage, not all of them, enough, had the courage to vote that in. That took courage. But some of them are facing re-election. You have to have courage to do this. And then connect and align the vision to strategy. What's the advantage to the organization if we have healthy and high-performing people and we have a healthy and high-performing workplace? And provide resources. They have to provide the resources. And then they have to be a role model and a cheerleading. They have to be the role models in some ways. They don't have to run marathons. They don't have to eat veggies. You don't have to be a vegetarian, vegan. They don't have to do any of that. You can still eat donuts. I'm going to finish up those donuts back there, but if you don't finish them up by the time I finish here. All right, and then they have to turn over to operations. Senior leadership can't take you from good to great. They can take you from great to good with a couple of bad decisions. We've seen a lot of that in the last 4 or 5 years. So senior leaderships create the vision, and they have to turn over to operations leadership to do it. Align the workplace with the vision. You have to create the culture and the environment that allow that vision to come alive. Everything about the organization has to be aligned. And eventually, if you have a small town, everything in the community, every place in the community has to have the same message. Brand it. Everything has to be branded so people know what this is about. Integrate policies into the culture. Every culture, every policy, whether it's absent days, whether it's workers' comp days, or whatever it is, pay schedule, whatever it is, has to be aligned with a healthy and high-performing culture. And everyone has to be engaged. 95% have to be engaged. I'll give you 5%. It'd be nice to have 100%. You can't put a changed person back in the same environment. Well, that change doesn't happen. So we haven't even touched the people yet. We're just fixing the workplace. That's where we made a huge mistake in America. Europe had it better than we did. They focus on the workplace a little more. We focus on the people. We blame the victims. You're too fat, you don't exercise, you drink too much, that's why we have health care costs. Well, there's some truth to that. But the main truth, I think, is in the culture and the environment and the policies of the workplace. You created those policies. Uncreate them or reinforce them, whatever is the right word. This is another natural flow. Each of you on one of those lines someplace. We have 2 million people in our database we scan. If we find $5,000 more spent in any one quarter, we put you on the red line, and we go back 12 quarters and forward 12 quarters. That's a natural flow of a heart attack or a serious medical problem. The yellow line is between $500 and $5,000. The green line is not even $500. Each of you, everyone in the world is on one of those lines someplace. There's no other place to be, unless you're Albert Einstein or people like him. You're going to be on one of those lines. So I use this is a natural flow, but I use this to decide what's going to be the right healthcare strategy for you, benefit plan. If you're designing benefit plan, we're very good at paying for sickness, but we got to reduce the errors, we got to coordinate services. That we haven't done. We thought just get them in the hospital, they'll get better and they'll be out of there. Didn't work. It's not working. Too many errors. People die in hospitals. People get errors. They get infection rates. No coordination of services. We got to fix those things. But that's still part of the good benefit plan. But that's what benefit plans have been for years. Just worry about sickness. Now people are getting better. We have disease management or care continuum coordination, whoever. Jeanette May back here is a research director there. So we know we got to do this. We got to take care of people because they can still be high performers with a disease. That's okay. Just have to help them be high performers. And the third part is over here on the health management side. How do we take care of people? How do we help them not get worse? How do we help them take care of themselves? Now that's a good benefit design because you have something for everyone. Now you just don't get sick. You don't have to wait till you get sick to have benefits. Everybody has benefits. And the nice thing about wellness is, like sickness, you just wait till you get sick. Wellness, you have to work at. Now you get people engaged.